So the trend for foams, and I'll just point this out to you guys, is that we have moved to silicone. And what we found is that when we cover these with silicone, that your patients like it much better because it's so much more comfortable. It stops a lot of burning and pain, and it doesn't rip and tear at their skin. So if you'll feel this, you'll see the inside, that it's gonna drain, but you'll find that there's silicone in there. That's the silicone adhesive, and it really doesn't stick, but if you stick it to your skin, you'll find that when you pull it off, it actually comes off quite comfortably. So I'll show you all of these because you'll see this common theme of the silicone, but I have one without it. So you can see. So this is an extra-absorbed foam, and what you're gonna find is the differences. This one doesn't have the silicone. So when you feel, it's a little different. So this one has a bit of silicone around the ring, but I want to show you guys what it does inside. So you can feel. So you can imagine that you have your patient, they're draining. So if you feel, that's just food coloring and water, by the way. I'm not putting anything weird on you guys. So it's not gonna stick to the wound. So when you pull that off, you're not gonna have that stickage like you would think, right? Yeah, it feels like a gel, because that's what it does, it gels up. And then this is also a sacral size, and you'll see this one again has the silicone inside if you look. It absorbs, but I just wanted to show you the shapes. They have shapes and sizes, this is, perfect for your backside coming up the sacrum. They have the ones that wrap around your heels, just different sizes of foams. Foams are used, again, they can be a primary or a secondary dressing. They can be used just to cover, or they can be used over a filler product. Okay, thin films, I showed you guys those are Tegaderms, and I don't think I have one with me today, but that's the Opsite that you have seen that they use over IVs, things of that nature. You can use those as covers or primaries. I don't use a lot of thin films, to be honest, because most of my patients need a lot more than that. So next is alginates and absorptives. So, okay, I'm going to show you these groups of products because we talk about absorptives, and there's two types of absorptive, well, more than two, but there's different types of absorptive products we're going to talk about. Mostly when we talk about fillers or things that you use to fill, you're going to use an alginate or a what's called a hydrofiber. So I want to show you the difference between them when you feel. That's the hydrofiber. And that's the alginate. So you can see how the alginate dries much more matte. It's crumbly, whereas the hydrofiber turns completely to a gel and almost liquefies. Okay, so I showed you guys the alginates. There are multiple, I can't stress how many multiple alginates on the market. They come with silver impregnation, so I'll show you one of those. I have one of those here, so you can see the change in the color. They come in packing rope, which I have one here. Let's do this one. You can see. They come in a packing rope. They come with silver, which you can see the color of that changes a little bit. All along, they're going to be different. So when they have silver, let's talk about silver for a second. Silver is an antimicrobial that's been used for years and years and years. When you put silver in a product, it will kill the bacteria. It affects the bacterial cell wall, and it prevents it from replicating. It kills that bacteria. Here's the key. The silver has to directly touch the wound bed where it's going to kill. If it doesn't touch, it doesn't kill. That's the way it works. Silver will also have chemical reactions with weird things, so you have to be very careful about using it appropriately. Okay?
Can that react with like their medications and stuff?
The silver generally not, unless it's put on topical. So if you're using, say, a topical steroid, or if you're trying to use sand heel, you can't mix those with silver, it's not gonna work. So you have to be very careful about what you use topically. Okay, so talking about absorptive, we talked about absorptive fillers, the alginates and absorptive fillers. Let's go. Also, when you get to absorptives, we talk about the composites. And these are super absorptive products. So these are the ones I'm gonna show you, the Eclipse. And you can see, when you feel that, y'all see the circles? It's got a silicone on it. What I wanted to show you really is if you look at my water and we start pouring. Now feel. And you can see, I put a lot on there. And it'll still keep absorbing. And so these come in all different sizes. This is another one in that product category. And I just want to show you, so you think about a leg, like a venous leg, also like pouring and spilling. And this is a big dressing, so you can put it like over a whole side of the leg. Now if you all watch. I'm not at full saturation, but this will hold probably 3/4 or almost all of this bottle with this. And now fill. It's totally dry. Across the top. Isn't that amazing?
That's pretty cool.
This product is called Elustra, and it does this, so I just wanted to show you guys this, because they're amazing that they can do this with the technology. This one changes a little bit, so I wanted to show you guys how it feels. There, right. Now feel. Oh, it changed. No, well, it soaks it up. So, I know you guys can't see this back there in the back, but earlier I had put this on here, and you said, this here, and you can watch it when you sit there, it'll suck it into it. I don't know if you can see it moving, but it's pulling the fluid, and you can see it here on the table. It'll just pull it toward it and keep pulling. But the interesting thing is when I stack it, it'll send it back to that dressing, and I can stack it here. You see it starts sending it up to that dressing, so it's a major wick, and it just keeps on wicking. Okay, next is the hydrogels. So for all these absorptive products that we talked about, the hydrogels are literally what they say. So these are the ones that you need to add moisture to. So I'm gonna show you guys, and the best way I can do this is to use this and just pop them out here. So this is a multi-dex gel, and it's much more thick and viscous, but it falls under a hydrogel. This is a honey gel, and none of these are open.
Yeah.
Come on.
This is cool.
Okay, and this honey, pure honey, you could eat this, no worries. In fact, I put it in people's mouth that have wounds like, cancer wounds, like from tobacco and things, and you have to pack a cavity in the mouth. The honey is completely safe to do that. And then this is Plurigel, and I'm not gonna take this out, but just to show you guys, this is a brand new product on the market. And here's the interesting part. So generally, when you think of gels, when they get warm, they become more runny, right? Like honey, it's warm or it's runny. When it's cold, what happens? It gets thick. This one is the opposite. When it's cold, the colder it is, the more runny it becomes. When you put it in the wound bed and it gets warm, it solidifies and holds itself in there. So, and it debreathes. That's one of its claim to fame as a gel. It's expensive as all crap. Oh my, it's very expensive. But just to give you guys an idea about that. And then the antimicrobials, we talked about honey and silver and what they do. And then one more antimicrobial I wanted to talk to you guys about is dexamer iodine. And I'll show you this one. It's iodosorb, and I use this product a lot. A lot. And it comes out as baby poop brown. But it will turn white as it interacts in the wound bed. And it's heavily antimicrobial. Your patient just can't be allergic to betadine or iodine.
Don't give it a
And
little.
then one last antimicrobial, which you guys have seen this, but I'll pass it around so you can see, is, you have these packing ribbon and things like that that are treated with antimicrobials, and this one happens to be treated with PHMB and another product. But anyway, in and of itself, this is treated with an antimicrobial that allows you to pack into the wound bed. Oh, wait. Am I supposed to? Okay. So, when we talk about silver dressings, just a couple things that you guys need to know is that they're appropriate for infected wounds. You want to use them in short course because they can stop you guys from getting epithelialization of your wound. They kill MRSA, VRE, Pseudomonas. And they're effective for up to 7 days in the wound bed, so you can see some silver. Okay, next is collagen products. These are the ones that make your wound granulate. And so, well, before I do that, so talking about the honey products, I showed you guys the honey gel and the honey colloid. So these are other products that are impregnated with honey. You'll find in every class, an absorptive, everything, you'll find a honey product in it. So here's an example of something that you can pack into a wound.
Is all the honey from all these products in the
Yes, all of it. So we're talking about somebody with tobacco that you pack into their mouth. That's an example. You just take that, cut it, and you actually can pack it into somebody's mouth. And here it's in packing ribbon, and it is sticky like honey. I mean, it's honey. It smells like honey. It is legit. And you can also buy Manuka honey to eat in your tea, coffee, whatever you want. Okay. So next, go into the collagens. So I have two collagen products here. One is stimulant powder, and you just sprinkle on the wound bed. It's been shown to get neangiogenesis or capillary formation in patients with compromised circulation. This is like gold. This is the Cadillac of collagens. There are other collagens, and I just want to show you guys, and you will see that they also come impregnated with silvers as well. So you can get silver collagens, but I wanted to show you how they do a little differently than the absorptives. They're not really for absorption. They actually form a matrix in the wound bed, and they will actually dissolve and become part of the wound. So you're gonna see a lot of dissolving. So when you put this in, you may get a little residue back, but for the most part, you're not getting anything back. I'll just spill that. But if you feel, you'll see how it starts to change, and it's actually almost melts away. So you wanna cut it to fit, put it in there. It comes in all sorts of formulations, gels, powders, solids, films, all kinds of things. And I should mention that, just in case somebody's allergic, it comes from bovine or pork, cows or pigs, is where you usually get this. And it is always a primary dressing that recovers a secondary dressing. So in other words, you don't just put collagen on there and leave, it's gotta be covered with something. Okay.
This one's weird.
So, alright, talk to you guys about gauze. Alright, let's talk about these, just a few products that we have remaining here that I wanna show you guys. So, when I talked about gels, we talked about the gels that squirt out of the tube. There's also solid gels, so you guys can get an idea. So I wanted you to feel this. This is a product called Elastogel. If you put it on, then it just lifts right off. It's bacteriostatic, so if you have a skin tear, something that's painful, burns, I've used it on
could just keep
motorcycle
smelling
burns,
this.
sunburns, everything. Then you put that in the freezer, and then you put it on, it really feels good. These gels also come in a silver sheet. If I can open this, I'll show it to you.
Interesting.
Although I will admit that this little silver sheet, it don't feel nearly as good as the other one. Okay. So then there's a group of products, and these are non-adherents, what we think of as non-adherents, and the reason we use them is because we want to prevent sticking in the wound bed. So if any of you have any experience with Vax, for instance, we may want to prevent sticking. So that's what these are used for. So this is Safe Tap, and it's used to prevent sticking, basically. You'll see that it's got holes that allows the drainage to come through, and so if I could use your hand. And now take it off and you can see that you can totally reposition it. So it goes, into the wound to prevent sticking. Also, the silicone, it makes life a lot happier for most people. That one, the Safe Tack, I'm gonna tell you, that makes you very happy as a nurse when you get to use that product, because only one side of it's sticky. But let's just show you. Pull that off of there. Can you pull it off? You'll see both sides are sticky. So when you try to leave that in the wound bed, it sticks to your glove. It sticks to everything. Like, how the crap am I gonna get this stuck? So, it's a two-sided stick. Then you're gonna see things like this dressing, which I'm sure all of you are aware of, which is just Vaseline impregnated gauze, but it does prevent sticking. Or you may be familiar with this one, which is the famous Xeroform gauze. Those work as well, but remember, those are, because of what they're made from, they're not gonna allow drainage to come through like these first dressings I showed you. Okay,
That feel good on a Sunday.
and then this is a combination of a non-stick and an absorbent, so it's got an alginate, plus it's got the non-stick edges. So if you think about where you're combining products.
This one's fun.
Okay. Okay, so,
This one's not as fun. I don't like this stick. It's not really sticky.
two more things to show you. So, my cat had a fun time with this. So this
Oh, yeah.
is a leg sleeve, an eclipse boot. So those dressings I showed you that were super absorbent, you remember we talked about those venous leg ulcers that pour, or those lymphedema patients? This actually wraps around their leg, like so, and comes up around their foot, and then you wrap compression over it. So this is gonna be a super absorbent boot in this dressing. So if you think about how big this becomes.
That looks expensive.
Yeah, it's not cheap. However, okay, imagine though, if you will, I'm gonna pay in the neighborhood of $50 for that dressing, $55. Okay, so that's expensive, yes, for a single dressing, that's very expensive, especially if I gotta have it for both legs. But then look on the neighborhood of what I showed you guys with those dressings that I sent around and the size they are and how many of those it would take for me to get to that size.
That's true.
And so you're talking about even that big sheet I showed you, that's like the 8x10, that's on the neighborhood of about 12 to 15 bucks. When I gotta have 4 of them, it doesn't take me long to get to 50. And 4 of those will last me where I can change that dressing maybe every other day because they're pouring that much. Well, that gets me to twice a week at 50 bucks. So in your mind, when you think about infused dressings, you gotta ask yourself, you gotta weigh how often am I gonna have to change it? How much am I gonna have to use? And you compare those. And so in my job, that's constantly what I'm doing is comparing, where are we at with this and what do I gotta have to get me, you know what I'm saying? So it's a trade-off that you really have to think about. So I did have today another common product I just wanted to mention to you guys that you were gonna see is a product called Hydrophara Blue. Is anybody familiar with that? It's a blue product that has, absorb my mess here.
This one smells
It's a blue product that,
I shouldn't
it's
smell
a
it.
violet color and it's got gentian violet methanol blue. And it's bacteriostatic, so it leaves that bluish color on the wound bed, but it absorbs, it's impregnated into a foam. So I don't have an example of that, but I wanted y'all to be aware because you'll see that pretty commonly. So you're gonna see also, and you should see, especially for your stage 2 pressure ulcers, which make up the bulk of pressure ulcers by far, is topical skin protectants or skin creams, powder, you know, what you think of. So I just want to make y'all aware of a couple of them so that you can feel how viscous they are and why you can use them on partial thickness areas. So they're usually made up of zinc, but this one is a spray. And so if we probably shouldn't spray it on that. Because I think that's, yeah. So, it's not, I may not be able to get the top off this, but anyway, if you imagine, it's a touchless, there we go. Spray. Okay, and I'll leave that white so that you don't actually have to touch the wound or anything like that. But if you feel that, that's gonna be zinc. And then there's this product called Camelceptine. And I'll be honest with you, every person in my household swears by this product. Because I don't care. If, you know, in the summertime when you have skin that rubs on skin and it's not a pleasant, y'all know what I'm talking about? You have those days, this is the best. So I'll spread it out so you can feel it if you want to touch. It is very viscous. And it's got calamine and zinc in it, plus a like menthol, and so it really cools down that area that's itching and burning. It works well, like 1 or 2 times and you're golden. Okay, so now we went through and talked about all these products, and you're asking yourself, okay, that's about 1,000 products that I still don't know what she's talking about. So, if you can think about what all these products do, and I showed you, if you look at your wounds, and I want y'all to think about them in 4 buckets. You can use buckets, boxes, whatever you need to use. 4 categories that you're going to move these into. So when you look at your wound, is your wound deep or shallow? So what does that mean? It means do you have to pack something into it because you have dead space to fill, or is it superficial? Based on that, you're going to move to 2 buckets. Once you determine that, for instance, that your wound is shallow, then you're going to ask yourself, is this wound wet and got excess moisture, or is this wound dry? Do I need to add moisture or take it away? Once you figure out which bucket that's going to go in, it's going to narrow down your product groups for you to decide what you need. So we're going to start with a wound that's deep, a wound that's wet, it's got excess moisture. Okay, you think about that wound. So what's the first thing with that wound being deep that you think you have to do? You're going to have to pack it. So we have to look at one of those products that I sent around that's going to fill in that depth, right? Then you know that it's moist, it's super moist. So you're going to have to cover it with a dressing that does what? Absorbs. That's what you're looking for. So when you walk into a supply closet or you're at work and you say, this is what I need, start looking for products, fillers, and something that's absorptive. That'll tell you what you need. And it doesn't matter which one you choose, they're all gonna work. You go in there with that knowledge that, hey, I need a filler, I'm gonna find one in here, whatever that is that they happen to carry as a brand or type they carry. Does that make sense? So that's the way you're gonna break them down in your mind. So the same thing, you're gonna get to a dry wound. So if I know that this wound is deep and it's dry, I'm gonna have to fill it with something, but I don't want something that's super absorptive. So I may fill it with the honey because it's gonna add some moisture, right? It's gonna be sticky and moist, right? So that honey packing that I sent around, that may be what you choose to do. You will choose something that adds moisture and maintains that without drying it out, okay? And there are also, I didn't have an example to bring to you guys, but you can also get gauzes that are impregnated with gels immediately so that you can actually, the gauze holds its place, but the gel adds to moisture. And that's one of the rare times that gauze is used as a filler, you know, is in those, when they're used as a composite part of the dressing. Okay. So then you have shallow wet wounds. So if your wound is shallow, but it's got extra moisture, do you have to fill it with anything? No. But do you have to find something that's absorptive to go over it? Yes. Does that make sense? So, and you may have to stack your absorptives. I mean, I have shallow wounds that I have to put 2 to 3 products on because I have to get that much because it's that wet. Okay? So like that wick product that I showed you, you know, you can stack that and have a couple stacks out. So, to make it go. All right? So next we have, come on, shallow dry wounds. So these are the wounds like this, that solid gel product. It doesn't need any absorption. It needs something that adds a little moisture. So that's what we're gonna do for those. We just have to cover them. There's nothing to fill. Does that make sense? So you're looking for products in those ways. Because you may be in a situation where somebody says, okay, well, I don't know what to put on it. And you're asking you, and you're the one that's gonna have to go, if you're in home health, to your car stock and figure out from what you got in your car stock, what is going to work to get me through today. Or you may be at a hospital and you have to go in a supply closet and you say, what is going to work? There is more than one way to skin a cat, and when it comes to wound care, that is definitely true. There is more than one right combination, but you have to know those basic buckets to know where you're gonna fit your wound into to go and select that product. Does that help make sense to you guys? Y'all are, yes? Okay, so I want to just really quickly finish up here and talk about just some high-tech things that you're going to come across, and you're going to come across this one pretty often, hyperbaric oxygen therapy. We have several chambers in Fort Smith. What this does is your patient, it's intended to improve their oxygenation. So once they go in that chamber, what it does, it allows their body to carry oxygen in their blood further to their distal limbs. So who does benefit from this? Your diabetics, people with crushing injury, and people with poor blood flow. However, they have to have adequate lung function to be able to do this. But what that does for them is, especially if they have a crushing injury or they're on IV antibiotics and they need bone growth, when you're trying to grow back bone that's not wanting to grow back, this can help them because it's going to allow them to carry oxygen further, and it also carries antibiotics further down because it allows the blood to flow further. Does that make sense? Okay, and then E-stim. Have you guys done E-stim? Did you know you do E-stim for wounds too? It improves oxygenation, it improves blood flow, it decreases inflammation, and it will stimulate fibroblast production. So we actually do put E-stim on patients' wounds on the negative polarity, and then you move it to the positive polarity, and it creates epithelialization. Ultrasound also, you guys do ultrasound? That over a wound, especially on deep tissue injuries and wounds that are stage 1 pressure ulcers, sometimes we'll do ultrasound over those to get new oxygenation and increased blood flow there. We also have MIRE, or monochromatic infrared light energy. Is anybody familiar with that? We have therapists that do it, and what you're doing is basically, it's not directly over the wound, it's actually at the level that they have circulation. So maybe they have a wound on the foot, but you're putting it at the thigh and the knee. And it's these infrared lights that you allow to go, and what those infrared lights do is they cause vasodilation by the release of nitric oxide, so it improves blood flow to that area. So if you look at these little things I have over here, you'll see that where it lights up, because they actually improve. This is what it looks like. And here's feet. You see how it starts to, you'll get like a 400% increase. It will open that up with the nitric oxide. Okay, do we have negative pressure wound therapy? This is also known as a VAC. Again, Kleenex, tissue. Everybody wants to call negative pressure wound therapy a VAC. I'm here to tell you that there are literally dozens of negative pressure wound therapy configurations. Most common, and the first one was the VAC, okay? But there's all sorts of them that do the same kind of thing, that have different foam configurations and things that you'll do. And there's even disposable ones where you actually hook the suction and it's, you know, just, you will remove it after 7 days and throw the whole unit away. So what it's gonna do is you're gonna put a piece of foam in there or gauze, and you're gonna add negative pressure on it or suction, and it's gonna suck out all of that debris, increase the blood flow, all of that. So here's some pictures of it. You see this was fasciotomy, and that's what it looks like backed. And then with the skin graft over it. So here's a foot. Has anybody seen a back? Any of you guys? You have. Where did you see it at?
Talahena.
Yeah, I was gonna say, they do a lot of them there.
Yeah.
You'll see, you know, when you get into clinicals, you'll see them much more in the hospital setting. Did you change it? Were you with them when they changed it?
Yeah. I saw them.
In some hospitals, the reason I mention that is because in some hospitals, actually the therapists and the PTAs do the changing of the backs. So if you work there, you may be, maybe that you have to do this. So the big thing with backs are two things, is, one, you never let the foam touch intact skin, or it will create an injury. Two, you never put foam in a place you can't get it out from, because you will have retained pieces of foam. When you're pulling it, it will pull apart. So those are the two. If you follow those two guidelines, you'll be okay. The third, I'll add a third thing, but if you don't have any experience, you shouldn't be doing it. Don't put it over organs or, you know, vessels, because I have had in my experience patients that they put it in wrong places and it bled out. You don't put it over cancer, obviously you're proliferating something. It can be a problem. But I mean, usually for you guys, you're gonna talk about putting them on knees and hardware. I mean, it's not, you put it on somebody's foot and you're not gonna, there's no organs there to damage. So here's an example of a guy that I had, and I don't know if y'all can see, but right there's a bone. Can you see that?